Good morning. I'm so glad you could join us. Today's talk is nutrition security in the Pittsburgh Hill Homewood research on neighborhood change and health, also called PHRESH for short. And we have Dr. Oroki Boulay with us today to talk about that. Dr. Boulay is a postdoctoral scholar in the Department of Epidemiology at the University of Pittsburgh. She was supposed to be here in person, but she has a respiratory bug, and so she agreed to go on Zoom, which we are very grateful for. So I'll turn it over now to Dr. Boulay.
Thanks so much for that introduction. Can everyone see my screen and hear me okay? Everything's all good? Okay. I'm just going to go ahead on my end and minimize the camera right now so I can see my slides myself. But, you know, if there's any questions, please feel free to interrupt me at any time in the presentation. Okay. Yeah, so thank you again so much for having me. I'm really excited to be here. And yeah, so that was a great introduction. I'm a postdoctoral associate in the epidemiology department. I work with, it's called the NEST Collaborative. It's a new initiative about neighborhoods, environments, and systems. So really trying to get more like community engaged work done, trying to understand more complex social problems such as nutrition security. And yeah, hopefully my voice and, you know, everything isn't, you know, too bad. And I appreciate you accommodating me on Zoom. So, yeah, really looking forward to this presentation and discussion with you all. All right, so let's go ahead and get started then. Let's see. Okay, so my agenda is just, you know, and again, at any point, feel free to, you know, ask me to pause if you have any questions, anything like that, you know. You don't have to make this like me lecturing everyone. So the agenda, I'm just going to give a little bit of my own background and training. And then I'll talk about what is food insecurity. I think, you know, most of us have some understanding it at some point, but, you know, when we're doing public health research and practice, it's really good to understand how, you know, it's being measured and examined. Then we'll get into this newer construct, which is nutrition security, which some of you may have heard about also. And I'll talk a bit about this PHRESH study, which is the Pittsburgh Hill Homewood research on neighborhood change and health. And it's been around for a decade or so at this point. And I'll talk about how we examine nutrition security and food insecurity in that study. And then, yeah, plenty of time for discussion and questions. So yeah, my background, I'm actually originally from Pittsburgh, as I'm sure many of you are as well. I was raised in the North Hills and out in Wexford. I have a bachelor's in biology and psychology from Cornell University. Then I did my master's in nutritional sciences at the University of Michigan, my PhD there as well, and my dissertation focused on food insecurity in adolescence. I also have some work experience at the Harvard School of Public Health. I worked there for around 2 years as a research assistant. And then, yeah, recently I moved back to Pittsburgh and I was a T32 Epidemiology of Aging postdoctoral scholar where I started focusing on, you know, nutrition security in older adults, and I developed an index for that. And now I've shifted to working with the Nest Center where I'm examining nutrition security in the PHRESH cohort. And I just want to mention that I do want to be clear that any points here are made are on my own. They're not representative of any funder or funding agency, anything like that. Okay, so I'll start with what is food insecurity? I'm sure many of you have heard about, you know, this topic, right? It sounds like you were already doing some initiatives to address this topic. Does anyone want to give their own take on what they think food insecurity is?
I will. I will. When I was, it hit me whenever I was a little girl. I went for a walk with my aunt, and they lived in Coriopolis. And she said that one of her neighbors, they were older neighbors, very old at the time, and the wife had died, so she wanted to check in and look at, see if the man was okay. And so we knocked on the door, and he was so glad to see us. And he said, "Come on in." And he said, she looked at me and he said, "I have bread and jelly." I said, "Okay." He said, "You want some bread and jelly?" And I said, "Okay." And so I went into his very small kitchen, and he opened up what was then an ice box. He still called it an ice box. And that was the only thing he had in his refrigerator. And I was only 6 or 7 at the time, but I was stunned because he only had white bread and jelly to eat. So that was my first introduction to what this is. And since then, I have other stories like that too, but I'll let you move on.
Yeah, no, thank you for sharing that anecdote. That is certainly what food insecurity is, right? Just not having enough food. And it is way more prevalent than, I think some people realize. I think many of us, there are people who have personally experienced it. I'm sure most of us at some point have, known someone closely or at least met someone that's experienced food insecurity, and it tends to, there's global iterations of food insecurity, right? Like when I've gone home or, to visit my extended family in India, I've certainly seen a different type of food insecurity there. And in the US, we do see roughly 13% of the population experiences food insecurity. So it is certainly a global and national problem. So the formal definitions are limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire those foods in socially acceptable ways. That's the US definition. And then I also use the second definition from the USDA a lot because it reflects how food insecurity is captured in the different measures that we use in research studies. So there's a huge focus on economic and social conditions of limited or uncertain access to adequate food. So this is a little bit researchy, but I do bring it up because I think it has really important implications for, how we study this issue and how we address it. So the overview before we're not going to get into the weeds with this survey by any means, but when we think about food insecurity, there's a lot of things that can affect it, not just your finances, although your finances are an important component. But this gold standard measure that we've been using, you can see some example questions here, like, we worried whether our food would run out before we got more money to buy more food, basically, right? So all these questions that are like the gold standard for how we like measure and address food insecurity, they tend to have a financial focus, which is really important. But I think you'll see as I get into it a little bit more that, it's important to consider money, financial limitations, but there might be more to the story than just focusing on your financial constraints, especially when you get into certain populations. So let's see, another example, question here is, in the last 12 months, did you ever eat less than you felt you should because there wasn't enough money for food? So sorry, one second here. Yeah, I'm just, it's a little bit with one monitor. I'm just balancing, trying to make sure I can see you all on camera and then also see my own slides. But yeah, so this is one of the measures. And then you can see that, as I'm sure many of you may be aware, food insecurity is a prevalent issue. If we just focus on that top line, that's, the trends in food insecurity over time, where it's, generally been around 10% and then trending upwards. And then with some of the recent, when SNAP was not funded and, all of that, you can expect those trends to go up for food insecurity to get worse. And SNAP, I think many, if not all of you are aware, but that's the Supplemental Nutrition Assistance Program, which provides nutrition benefits, or at least, money for food for lower income individuals. And then, like I mentioned, what I'm studying specifically is food insecurity and nutrition insecurity in older adults. So you can see some of these trends are, higher than we would like to see, certainly, and also trending upward. That first top line, which is orange and a solid line, is food insecurity in households with adults aged 65 and older living on their own. And you can see it's getting close to 12%. So, yeah. So any questions on that before I get into how it affects health?
Was I
Okay. Yeah, go ahead.
that previous chart for the older people? It looked like they were somewhat lower than the general population up until recently. Is that true?
Yeah, yeah. And yeah, there's it is a little concerning to see that for sure. And these are let me see, these are percents. So we know that there are more older adults than there used to be. We're also seeing, people retiring or being semi-retired and then, like continuing along. So I'm not totally sure what's driving that trend, but it is a concerning trend. And I think that's what some of this research is trying to address is, what's going on and how can we prevent food insecurity in older populations as well. But it might be that, the economy is getting, a bit worse, unfortunately, and maybe that's reflected in how older adults are able to cope post, work, post retirement. But yeah, that's part of what we're looking into for sure.
I had a question. The Trump administration just announced they're going to make all SNAP recipients reapply for benefits. What do you suppose that will have? What effect do you suppose that will have on food insecurity?
Yeah, so anything that causes an administrative burden to individuals will certainly make things more difficult. For example, for SNAP, right? Like any policy that, um, basically makes it a little bit more of a barrier for people to be part of the program, tends to put people at higher risk of food insecurity. Yeah, just because, if people are, let's say, lower literacy, or they don't have a lot of time, or they're not feeling well, and they have trouble going through that process. For some people it's not an issue, but for some people it becomes a bit of an extra burden. Yeah. And then, there can be processing delays with paperwork and all of that too. Yeah. So the reason we pay attention to food insecurity is because it really does affect your health. As I'm sure many of you can just anecdotally, be aware of from maybe what you've seen socially or in the news, or, people like friends of friends that may be affected. So one of the things is, it's associated with worse dietary quality, right? If you're not able to afford the right foods, it's really hard to eat healthy. And through that, and also through, the stress of food insecurity, you may be at a higher risk of chronic conditions such as diabetes, cardiovascular disease, and also poor mental health, anxiety and depression. So food insecurity can basically affect your health in a lot of different ways. And a lot of those, things can also put you at risk for other things. So for example, if you're highly anxious or stressed, maybe that affects your cardiovascular disease risk a bit. Or, of course, if you're eating poorly, that increases your risk of chronic conditions. And then, so what I've been looking into more recently is how does food insecurity affect health in older adults? So adults aged 65 years and older, that's the typical definition of older adults. Up until a few years ago, this was actually pretty understudied, and now a lot of people are starting to focus on this.
Progress.
Sorry. Oh,
Okay. Trying to get it to fix this. Oops. Sorry. Okay.
Was
Okay.
there a question?
No, we were getting a lot of feedback here in the room and
Oh, okay. Okay. I'll just
Sorry, folks. I was trying to switch to my computer and I'll give it up.
no worries.
Thank you very much.
Yeah, okay. So yeah, for older adults, we see similar patterns of, there's poor diet, which can definitely be concerning for older adults who are trying to maintain muscle mass. There's also a higher risk of medication non-adherence and physical function limitations and poor mental health. And, there may be more. It's just that we're still studying this topic because, it's only recently that people have started to really delve into this for older adults. So, like I mentioned, food insecurity, it's obviously a very important public health issue. But people recently have started talking about nutrition security. I'm curious if any of you have heard of nutrition security outside of this presentation. Don't think so. Yeah. Okay, well, great. You'll be introduced to it now, which is important and great. Okay, so nutrition security is similar to food insecurity, but there's more of a nutrition focus to it. So it's about consistent availability, access, and affordability of foods and beverages that promote well-being and prevent, and if needed, treat disease. So it's a newer concept from like roughly 2020, 2021. And I don't need to get into the weeds with some of these measures, but again, in public health, when you're doing research, it's so important how you measure things because that affects how you're able to address them. So this is one example of a nutrition security measure from the Center for Nutrition and Health Impact. And you can see that the question is a bit different than what it was for food insecurity. So for example, that first bullet, we had to eat some foods that were not good for my health and well-being because I couldn't get other types of food. Right. So there's much more of a focus on health and well-being. And you can actually, if we just skim through there, you can see there's a focus on that in most of the questions. And here's another example. Again, we don't need to get into the weeds of all the different components of it, but this is a different nutrition security measure from Tufts. So instead of just, did you have enough money for food, it was, how hard was it for your household to regularly get healthy foods that support your well-being? And then it lists a few different reasons people may not be able to eat healthy foods. And it asks you to specify what your reasons may be. So the first one, healthy foods are too expensive, right? That's pretty similar to what food insecurity measures. But there's, some other things. So like, for example, D, I don't have a car or other transportation to reach stores or food pantries that have healthy food options, right? Or, E, I don't have enough time to shop for healthy foods. So I think these are important considerations. And again, this is some stuff that, in some ways may feel common sense to anyone who's going through the situation, but it is really important that we capture that in the research, right? Because the initial food security measure I showed you doesn't take this stuff into account, and that can be really, really important. So especially for older adults, M towards the bottom, I have mobility challenges or physical limitations that make it difficult for me to prepare healthy foods, right? That can also be a really important thing to think about for overall health.
We had a
So
question.
yeah, go ahead.
So in all of those questions, nothing really addressed whether or not they knew what healthy foods were.
What healthy foods were? Yeah. So that's a great question. When you get the screener, they give you a definition of healthy foods before they ask you the screener. I didn't include it in here because it would have been like a ton of text. But at least for this screener, they do. I am not sure that they do that for the previous screener, so that's a great point. And these measures are still in development, and I think it is really important. And I agree that, like, even if you define it, people have different conceptions of what healthy food is. Some people might think that a keto protein bar is very healthy. Someone else might think that, oh, it's, very processed. I wouldn't find that to be healthy. So I do think that's a really important thing to think about for sure. But yeah, at least for this measure, they define it. as well as they can. And, you know, some of these things are going to be a little bit subjective because they're asking people about their experience, but we still do want to know about their experience. If they feel that they can't access healthy food, that is still really important to take into account. Yeah, but great question.
Another question?
So this, yeah. So this kind of summarizes, you know, all the different things beyond food security that we may need to consider for nutrition security. So obviously money, so that's the food security part, but also transportation, your neighborhood environment, can you easily get to a grocery store, your functional ability, time, food assistance programs like SNAP, food pantries and banks, and also social support. Like even if you're struggling, do you have a neighbor that will invite you over to dinner and just kind of, you know, help you out? Do you have, you know, are you part of like a community organization that, you know, will be supportive of you and like have a food drive or something like that, right? So those are all important things to think about beyond just, do you personally have enough money for food? Although, of course, we would want to address that too. So this is just a brief summary of what's going on with this research. So again, the concept of nutrition security is more nutrition and health focused than food security. It's broader. It's not just about financial access. So all this new emerging nutrition security research expands on the existing food security research. And we're really trying to make sure we define and measure nutrition security appropriately so that it is, you know, translational for public health impact. And we do want to see how it's associated with health outcomes. So my upcoming research with the PHRESH data is using data-driven methods to formally determine important nutrition security factors and see if these nutrition security factors relate to diet, and then also actually cognitive outcomes is a new area of research. So that brings me to PHRESH. Let's see here. So in 2010, there was this focus on food deserts, which became part of the national conversation. And then just give me 1 second here. All right. Whoops. Sorry, my Zoom settings are being a little funky. Let me just. Okay, great. Okay, so basically, does better access to full service supermarkets lead to healthier diet? Okay, so basically, Pittsburgh was a key research opportunity when they were talking about bringing a new full service supermarket to the Hill District. And the groundbreaking was in 2011. I imagine many of you may be familiar with some of this, at least in the local news. And honestly, some of you might be more familiar with the Hill District and Homewood and, you know, all of that history than I am, if you're from here and you've been around. But I will just do a brief overview just so that everyone is on the same page. So here you can see the Hill District and Homewood neighborhoods. The Hill District is in blue, the Homewood neighborhood is in yellow. So basically, these are the historically Black neighborhoods in Pittsburgh. And, you know, due to a variety of reasons, they became food deserts. So basically, up until like the 1950s-ish, you know, they were doing pretty well. And then the city claimed eminent domain due to urban renewal efforts and displaced quite a few businesses and people. And then through a lot of that, there was a lot of urban blight and poverty. And then, I think there was some awareness of that, and then, some initiatives to address that, more recently, especially with this new supermarket. And so lately, we've been seeing a lot of like reinvestment back into these neighborhoods. But yeah, basically how this results to, how this relates to nutrition security is PHRESH studied how this new supermarket opening, how that affected food security in the Hill District. So the supermarket was partially supported by America's Healthy Food Financing Initiative, and it opened in 2013. And basically, they collected data as this happened to see, okay, what was the impact of this supermarket, right? So basically, they wanted to see, okay, we see poor diet and food deserts. If we bring in a supermarket, does that, help, right? And you would assume that it would help to have the new supermarket, right? But with research, again, you can never make assumptions. You always have to test everything out. And so basically they recruited people from the Hill District and also from Homewood. So the Hill District was like a control neighborhood, and Hill District was the intervention neighborhood. That's where, the intervention of the supermarket was happening. And then Homewood was the control. So we were trying to see over time, like, okay, so how do things change in the Hill with the new supermarket compared to Homewood? That way we know the trends are not just based on time. We can say, okay, it was actually like, we're pretty sure it's the supermarket that might be influencing things. Although, you can never really say for sure until you do a randomized controlled trial, which is not possible in this situation. But anyways, that was kind of the study design and the participant characteristics. It's definitely a lower income sample. This was data from baseline, so from like the early 2010s, but the median annual household income was like $13,000. And then 95% of the sample is African American, and the average BMI is 30.5. So definitely a higher BMI sample also. And PHRESH has evolved over time. So the initial study focused on food choices and shopping behaviors. Then PHRESH Plus looked at, green space and physical activity. Then PHRESH Z's looked at sleep. PHRESH Heart looked at cardiometabolic outcomes. And then what else? Oops, sorry. Then this last one is Think Fresh, and that looks at cognitive outcomes. So it's basically, the course of many years from 2011 to 2025, looking at food security, nutrition security metrics, and all these other things that, are different health outcomes. Sorry, one second here. All right, let's continue along. So any questions on the PHRESH study itself before I get into the nutrition security topics within PHRESH? Okay.
Was there any other intervention besides just putting the grocery store there, like educating the population about how to use it?
Sorry, could you repeat that?
And in addition to just putting the grocery store in place, was there any other intervention in the neighborhoods, like educating the population about healthy food?
So that's a great question. I think, education is always helpful for anyone. I've even seen, peoples with, PhDs in engineering sometimes not understand important nutrition distinctions. So basically, from a research perspective, we're really careful when we do studies like this to make sure that we're measuring one thing, right? So when we don't want to contaminate the initiative of the, supermarket with an additional training on nutrition, because then you can't tell the difference. Like, okay, what was actually impacting people's health? Was it, the supermarket, so better access, or was it the training, so they learned to eat more healthily? Or was it both? And then you can't tease out those individual effects. So we did not like this study. It only looked at the effect of the supermarket, and there was no other intervention at that time, just to see, the sole effect of the supermarket. That being said, nutrition education is always important. I'm always supportive of it. But I think, especially in lower income populations, you'll see that, most people understand the basics of like, you're supposed to eat more fruits and vegetables. But if you can't even get access to those, the education's a bit of a moot point, because you might know that, but if you can't afford it, you don't have time to prepare it, then you're still stuck, even though you have the nutrition knowledge. So I think it's always important to, think of both. Like, you want people to understand nutrition. You also want them to have access. And in this situation, we were more focused on, the supermarket and then that type of access. But that's a great question.
Couple questions. Is there a correlation between nutrition insecurity and obesity? Number one. Number two.
Yeah. So
talk about the intersectionality between homelessness and food insecurity.
yeah. So was your question, is there an association between nutrition security and obesity? Is that the question?
Yes.
Okay. Yeah. So basically, nutrition security, because it's such a new measure, we will see if there is. I think that there would be, but I can't say for sure until we actually look at the data. But for food insecurity, there definitely is for adults. If you're food insecure, you're much more likely to be of a higher BMI, at least in the US. That may look totally different, in other countries, but in the US, food insecurity for adults is associated with a higher BMI. And actually, for older adults, we don't know for sure, right? Because that is still an important research question that's yet to be addressed. But for the general population, you will see that if you're food insecure, experiencing food insecurity, you're more likely to have a higher BMI, so more likely to be overweight or obese. Yeah. Okay.
The other question was
Trying to
about
keep it. Sorry, was there another question?
Is there could you talk about the relationship between homelessness and food insecurity?
Yeah, so I'm not as much familiar with food insecurity, and like, obviously, like, if you're like, if you're housing insecure, right? If you're less likely to be housed, you're more likely to be, experiencing food insecurity. And a lot of times those things coexist, like, not having housing and not having, enough access to food, or like healthy food. I don't have like statistics off the top of my head, but, those problems do tend to coexist. Yeah. I'm also happy to share my contact, at the end of the presentation for any other questions where I may not have the data right on hand. All right. So now let me get into some of what we found in PHRESH. So basically, PHRESH started with studying food security, but it also looked at so many other measures that are important for nutrition security too, such as like geographic food access, distance to different, distance to different grocery stores, your perceived food access. So it was like, it's a very unique study in the way that it was considering a lot of these factors before we even really had the construct of nutrition security. And I know that there was some interest on income and dietary intake, and I do think that sets the stage well for, what we found in PHRESH. But, you all may be very well aware of this, but yeah, nationally, being higher income does correspond to a higher quality diet. And, the PHRESH sample is lower income. And, we have this measure called the Healthy Eating Index. And you can see that for the baseline PHRESH study, the healthy eating index score was like 48.4 out of 100, which is pretty low. And for comparison, the national healthy eating index score at that time was 57.2 out of 100, which is also not great, to be honest, because you would want to have a score that's like in the 80s, ideally like the 90s. And, nationally, we're not doing great, but you can see that the PHRESH cohort, which is lower income, is actually performing worse on that metric. But you can see the overall pattern between higher income corresponding to higher diet quality. And one of the important findings from PHRESH is that when you invest in a neighborhood, you can see improvements in dietary intake. And the neighborhood investments, can be a variety of different things, but anything that improves access to healthy food. So like the supermarket improved access, but there may be other ways to improve access to healthy foods. Like, this is just a hypothetical example, but if there were some type of intervention where the, job security improved in a neighborhood, then you may see that you're going to have better food security because people can simply afford more food. So that research is still ongoing, but there's a lot of ways to improve dietary intake. So basically, when the supermarket opened, the diet and perceptions of access did improve in the Hill District. People consumed fewer calories, less sugar, fewer empty calories, and they were more satisfied with their neighborhood. But the interesting thing is that none of those were directly tied to the supermarket use. The only change that was better perceived access to healthy foods. So that was really interesting. So basically, you were seeing these like community level changes, but it didn't necessarily have to do with it's not like they were shopping at the supermarket and then buying healthier foods. And then that was like directly tied to improvements in their diet. You were seeing this group level improvement in diet. But the only thing that we could see that was directly linked to like, okay, these people shopped at the supermarket and they're reporting this difference was they perceived better access to healthy foods, if that makes sense. So that was really interesting. So, one possibility is there was just a larger awareness about eating healthy, or people felt like, oh, people are investing in us and it's making us feel better. And then that improved health. But that's a whole other research question. But that was very interesting. And yeah, you can see that, Hill District residents saw a larger improvement in reported access to healthy foods thanks to the supermarket from, 16% in 2011 to 72% in 2014. And then you have your control neighborhood, right, which just went from 22% to 27%. And then this was more about fruit and vegetable access, this specific statistic here. And yeah, you can see same thing. If you measure perceived access to healthy food with an index, you can see that it improved for the Hill District, although it improved for both. That's why we like to have a control, but it did improve over time. And I think you, again, if you're from around here, you would be familiar, but basically the supermarket originally was I always get mixed up. I think it's a Shop and Save. And then I've lived in Boston at some point, so there we have like Stop and Shop, not that one. But that opened and then it unfortunately closed. And then Salem's came in and now they're leaving. But these are just some statistics on food purchased at the Salem's grocery store. So the newer one that's about to leave or has left. So it's mostly produce and drinks. And then some of the most important considerations when people say that they're doing their food shopping in the PHRESH group are convenience and quality of food. And then, there was some satisfaction with Salem's, but there were some concerns from the community that, the supermarket wasn't as tailored to the community as they would have liked to see. So now they're actually transitioning to Macedonia Church, which is going to take over Salem's and continue the supermarket with more of a community-driven focus. So yeah, I think the good thing is, if you look at the data over time, food insecurity rates have been improving in that cohort. They've also been declining overall, whether that changes. I think I showed a slide where you can kind of start to see food insecurity nationally spike back up. We just have to see what happens with all these federal changes. But we did learn something interesting from the PHRESH study, which is, having a supermarket can improve your diet and health, or your perceived access to healthy foods, even if you're not directly shopping at that specific supermarket, which is really interesting. So yeah, just a bit of a summary. So nutrition security may have some important public health implications, but it's a totally new area. So we kind of have to start with the food insecurity literature and kind of start building out the nutrition security literature. So food insecurity, like I mentioned, we've already established it's associated with poor diet, higher chronic disease risk, poor cognition. And the next step is to see how nutrition security, which is more broader and more health focused, how that might be tied to dietary intake, chronic disease risk, and cognition. So with the dietary intake side, I'm looking into that with some of the PHRESH data soon. Chronic disease, some people have started to see if it's tied to diabetes, yet to be, established because all of this is so new. And cognition, I've submitted a grant to look into that. So if that gets funded, I would be able to look at that. And yeah, I just want to thank, as I start to wrap up, my current content, Dr. Dubowitz. She's the PHRESH PI, principal investigator. So she's in charge of this study. She's the one who initiated it. Dr. Rosso is a PI that was heavily involved in PHRESH. Dr. Stratmeyer was, my former postdoc mentor who also helped me with this presentation. Rand Corporation. So PHRESH is a collaboration between Rand Corporation and Pitt, and now it's mostly housed at Pitt, but it originally started at Rand. And then a few people, Ada, John, Nina, Mengi, they are some of the trainees that had helped me with these slides in the past. And of course, all of the PHRESH investigators, staff, and participants. And then, yeah, so thanks to all of those folks. We have some sponsors and partners listed here, such as Rand, Pitt, NIH, the Hill District organizations, Homewood organizations, and of course, our participants and residents of the Hill District and Homewood. So yeah, I'll pause there and then happy to address any questions. I also have some extra slides. So yeah, happy to discuss.
I have a few. So did you have, most of this was survey research, correct? Although you did have
Yeah.
some other blood and info. But I was curious, so there are different arms of the study. Did you recruit different participants for each one of those? Was there carryover and different sample sizes for each of those also?
That's a great question. So it's as much of a cohort as possible. So that means that we're trying to keep the same participants and follow them over time. I do think with Think Fresh, that they did recruit a few more households just to maintain the sample size. But there is a bulk of participants that have actually been the same and retained since 2011. Yeah.
Rohit, I have two questions. First of all, how did you recruit the participants? Were they paid? And secondly, did you get any background on them that might correlate with your findings, such as the, I'm blanking now, as their transportation? I think you did cover that, but whether or not they could get to these, because just the access itself might not,
Yeah, so Tamara Dubowitz, the chair of the Epi department, she would be able to speak to this much better than I can, because I think in 2011 I had like, yeah, I was just starting college, so I wasn't around when, the study was started, but it was meant, so they basically targeted specific households that, they thought would be informative to have in this study. I believe it was like a random convenience sample or a random sample, and then they sent out flyers and, recruited that way. And, everyone is compensated
Okay.
for all of this. They are certainly compensated. We have a field office in the Hill District, so a lot of people can stay local. They don't have to come all the way to Oakland. So there are, like, I would say this study out of, like, compared to many others, is very, very good about, engaging the participants, making sure they're compensated, trying to make sure that, there's not like transportation barriers and things like that. So the details are a little foggy for me for the 2011 stuff because I was not a part of it. But for example, for the study that I proposed, I proposed to cover the transportation costs because, I think it's really important if you're studying nutrition security and you're worried about transportation being a barrier to nutrition security, it may also be a barrier to, people coming to participate in the research. So, yeah, so I hope that's helpful. Yeah.
There's now an Aldi's at the intersection of Wilkinsburg and Homewood. So do you see that? I mean, people could walk there from Homewood. Do you see that impacting your study?
Sorry, did people walk where to Wilkinsburg?
Well, it's at the corner, it's on Penn Avenue. There's a brand new Aldi's that opened last March.
Yeah.
And
So
that makes it much more accessible to get their food from Homewood.
Yeah.
Bus up to the Giant.
Yeah, so I think probably now we're looking more at, we're continuing to measure food security the way that we've done previously. And I think so. I don't think it would be in the data that I have, which some of the data is like 2021, but in the next wave of data, they would probably be asking the same questions, which is, food security. And then what they do is they actually get the participants' addresses and they like look at geocoded data. So they would be able to capture if the distance to a grocery store with the new Aldi's is now all of a sudden a lot closer. So we would still continue asking a lot of the metrics, and then the data should be capturing that at least through the distance to the nearest grocery store.
Thank you.
Mhm.
I'll take this one.
So, our church and some other churches that we work with are focused on communities in the Mon Valley, kind of Braddock down to Clairton. And our effort has mostly been having to do with air quality, but in talking, hearing the people in there, they talk about the food desert problem, especially up on the Clairton end of things. I'm just wondering if you have any interest or any plans to, to look at those communities that have a similar problem.
Sorry, could someone repeat the question? Maybe someone that's close to the camera or the microphone.
Seems to be okay. All right. So I guess I have to be close to this. So can you hear me now?
Yeah.
Okay, so our church and some other churches that we work with are focused on communities in the Mon Valley, kind of from Braddock to Clairton. And our effort has mostly been on air quality, but in hearing the people from there, a lot of them talk about the food desert problem, how they used to have grocery stores, and there was even sort of an effort to try to get an Aldi. But I think that's kind of a heavy lift. It might be more reasonable to get a Dollar General upgraded. Some of them are upgraded to have better food. I just wonder if you have any plans to study other communities like that.
That's a great idea. I think if we had the funding, we would certainly look into that. I think right now it's just like everything we do has to be funded in one way or the other. So, I mean, I could certainly pitch that idea to like study that. And I think that's a great point of interest. I think that would be a great idea. Right now, it's all kind of based on what's currently funded. So what currently funded right now is to continue looking at PHRESH. But I think it's really important, even if it's not necessarily my exact research group, to look at this in other populations, other neighborhoods, and see what's going on. But I think that's a great point. And some of this is going to be more, research. Some of it might be a bit more public health practice or community engaged work. Not everything has to be, research.
Could you talk a little bit more about the moving into the Macedonian church to be more, to offer more resources to fit the neighborhood?
Yeah. So I can talk a bit more about that. So I think what they're trying to do, and again, Tamara, Dr. Dubowitz, she would know best. And, they're doing some community engaged work there. But basically, they would like to run the store in a way that, meets the community preferences and is a bit more tailored to the community. So let me go back to, you can still see my screen, right? Let me go
Yes.
back here. So basically what happened is, so we have a lot of data on some of this stuff. So the food purchased, what's most important to you, how satisfied you are. So basically what we've heard from the community is that, there wasn't a lot of like meeting the community halfway on the type of food products that were available, and stuff like that. So the overall satisfaction with the Salem's market was not as high as it could be. And I think because Macedonia Church is, more willing to work with the community, like I don't even know at what stage they are at this point, but they have certainly agreed to be more of a community partner and meeting people halfway for the types of food that's available and being a bit more flexible and adaptive in that sense. So I honestly, I think I haven't heard specific details of what they're doing, but just the fact that they're trying to, like do something that works for that community, I think that's great. Let me see if I have more slides here. I have like a bunch of extra slides, and some of them might have some more information on, where are they? Maybe they're here. Okay, have you visited the grocery store? Okay, so like for example, Salem's met some of these criteria, but some of the things that were a bit lacking were choice of items, price, quality of food. So they might be trying to address it more through that perspective. All right, one second here. Yeah. So lots to be determined, basically. Any other questions?
I have a question. PHRESH has developed metrics for quantifying food insecurity, which could be useful for assessing the efficacy of different kinds of interventions in a community. So based upon what you've learned so far, what particular interventions would you recommend that either community groups or local government attempt to implement?
Yeah, so that's a great question. So yeah, PHRESH has so much data on this stuff. I will say before we get into like what I think would be a good idea, I think one of the most important things to keep in mind with this type of work is that it is so specific to the population. And I think that's part of PHRESH's strength is that, they worked with those populations and we learned what are specific barriers in your specific community. Right, because sometimes, like for example, for something like, trying to think, yeah. So metformin and like diabetes or like vaccinations, right? We can get a sense that for most people, it's going to work similarly biologically. right? It's not going to be the exact same, but generally it might be, you know, if it's safe in one person, it's likely to be safe in the other. Or if it works in one person, it's likely to work for another. But for stuff like this, which is so specific to community, or, you know, for example, a group of older adults or a group of, you know, younger adults, it's really important, even before you do the work or to do the intervention, to meet with the community, kind of get a sense of like, okay, what are the difficulties in this community? Because for some people, and I think that's kind of what I was trying to get at a little bit when I was showing all the different considerations for nutrition security, is that, you know, for some people it might be like, hey, I don't have enough money. For some people it'd be like, I have enough money, but I have functional limitations, so it's really difficult for me to shop and cook my own food. Or it could be, you know, I have enough money, I have, you know, functional ability, but I'm a young parent, I just don't have enough time, right? So I think, you know, for each community, I would recommend meeting with the community, you know, talking to them, saying like, what do you think would be helpful? What do you think are the main barriers? What do you think would be the most useful? Trying to get some data there. You know, you could even, like, again, I'm happy to provide my contact. You could partner with, you know, a researcher and a community organization and the community. And then you can get into some of the, collect some data, get some, you know, get some stories from the community, and then starting to get into the work. And then for interventions, you know, we've seen that the supermarket was helpful, even though that's not exactly, it didn't work exactly as we expected, but it did help. What else? Anything that kind of, let's see, I've found in many instances that, you know, urban gardening, that can be helpful. Um, you know, fruit and vegetable incentives at farmers markets, that tends to go well. Um, you know, making sure that if you're doing a food drive, or, you know, you have a food bank, that you're also stocking it with healthy foods and not just processed foods. So all of those things tend to help. And a lot of it is kind of common sense, but I think the main thing is making sure you're meeting the need that needs to be met, and not just providing an intervention that's mismatched, if that makes sense.
Any other questions?
I was curious, did Salem give any reason why they stopped? They were so enthusiastic at the beginning. No, in Oakland, a number of years ago, a Giant Eagle closed, and the original Shop and Save in the Hill District closed, and the public reason they gave was not the lack of customers, but the theft was so high that it prevented a profit. I'm wondering if Salem gave a reason.
Yeah, so I only have access to that newspaper article that where they announced it, and they just said, you know, yeah, like financial reasons, and then like a few other things, like just kind of like generic reasons. So I don't know the exact reason. And I'm sure, like, I wanted to go to one of the community sessions, and I think we would have had a more candid discussion then, but I was unfortunately out of town. But I feel like maybe there it was discussed, and I can, you know, check with my PI at Pitt, and she probably has a better understanding. But I think sometimes what happens is, you know, it did seem like there was a mismatch between, you know, what was being offered and what people wanted. So it's possible that the financial reasons were, excuse me, that, and this is just me speculating, but you might just not have enough turnover with certain food items, or enough purchases, if there's a mismatch between what the community wants to buy and what's being sold. But yeah, I can't make any assumptions or, you know, anything like that. And I think, yeah, I'm guessing my Pitt PI might know more about some of those details.
I have a question. The point of putting this supermarket.
Sorry, I think you're muted. Um, right now the form camera is muted. .
Oh, it is muted. I'm sorry.
Repeat what you said, please.
What I said was that Salem's or the other other grocery store are in the community, but they're not in walking distance of a huge number of people, I would think. So the people who go there, most of the people who go there still need transportation of some kind. And once they have that, then they might prefer to go to Market District or somewhere else. I don't know how helpful it is to have it right there in the community.
Yeah,
Except
that's a great
perhaps
point.
the community in the way that you said it wasn't being done well enough.
Yeah, so I think that's a great point. So we've found something similar that, for people who are more food secure, they actually tend to drive further away to go to different stores. So these are probably also people that are higher income, they have a car, they might have better health, and they don't do some of their food shopping in those neighborhoods. They actually go elsewhere to get, better food or, the food that they specifically want. Maybe they even do some bulk shopping at, like, I don't know, Costco or something. So that is really important to keep in mind that, like, people who have transportation are going to go elsewhere, but at the same time, those are people who are already having more food security and they're not as at risk. There may be people who do need that store to be within walking distance or at least a close driving distance or taking public transport. And I've seen some anecdotal information, at least, that people do feel like it is important to have the grocery store nearby, that, like, for some people it does make a difference. I think the other thing that we want to really make sure we keep in mind is the main findings from PHRESH, which is that, even if people are not using that supermarket as much as we quite expect, we did see huge improvements, not huge, but we saw improvements in the overall dietary quality of that group, or at least for specific things. And I think there's certainly something to be said about neighborhood investments that, yeah, not every single person may take advantage of it, but that doesn't mean that the community does not deserve it, right? So I think, all these things sometimes have these spillover effects that, are hard for us to measure, or maybe some people are like, oh, it doesn't matter to me. I'm just going to drive wherever I want anyway. And that's fine for them. But, especially for someone who's like, I can drive, but my health isn't great, so I don't want to drive half an hour. I just want to drive 10 minutes, right? Or, it's a bit of a walk, but I can do it and I don't have a car, or on a bus, it's 10 minutes compared to half an hour. Maybe all those things do start to add up. And, I think it's always an evolving research question, but, the findings from the first supermarket were promising. So that's something to keep in mind too.
I had a comment to make. The Salim Saladon. I actually visited Salem when it was open, and I was surprised because it had exotic fruit, and the bakery department was one of the best probably in Pittsburgh. They had fresh fruit, fresh baked goods, fresh bread. And the way I ended up there was because it was being advertised in the Middle Eastern community, because they had sort of catered to the Middle Eastern taste and needs and so forth. So when I was surprised that I knew it couldn't last because prices were high, the food didn't match the metrics of the neighborhood. So I'm not really surprised that Salem is not functioning anymore.
Yeah, it sounds like it could have been really great for, the Middle Eastern community, but it's just PHRESH is, like, at least the cohort is 95% African American, and maybe there was a bit of a mismatch there, which is basically what everyone's been saying. And yeah, thanks for sharing your experience. Yeah, so, like, it kind of gets back to my point originally of, like, you need to make sure you're doing the right intervention for the right group of people. And that can have a really big positive impact. But if it's a mismatch, sometimes you're not going to see improvements.
Yeah. I have a question. Can you hear me?
Yes.
Yeah.
Yes, thank you, first of all, for a really, really wonderful presentation. It's so interesting to look at how you've functioned and what you've come up with. One question, you found that the average income, and I think this may have been both Homewood and the Hill, was $36,000 a year. Is that right?
Oh, it was actually lower. Let me go back to that slide. It was like 13,000,
Oh, it's
but that was at
13,000.
baseline. Yeah,
Okay,
that was at
okay.
baseline
And
in
was
the
that
early
an
2010s.
average, did that include both neighborhoods then?
Yeah, that was
Uh-huh.
collective. Let me just go back to that. I think it was right here.
Was the
Yeah,
average of the
so it would have
Yeah,
been for
okay.
both.
I got the
Yeah.
three right, but, so do you know how stable, when that measure was taken and how stable the neighborhood is over the time of the PHRESH study?
Yeah, so let me think. So this would have been at baseline. So it's either 2011 or 2013 or 2014. So around
Uh-huh.
that time.
Uh-huh.
And then I'm trying to think. It's still considered a lower income sample. I'm
Sure.
hopeful that it's improved since then.
Uh-huh.
But I don't think it's not high,
Right,
unfortunately.
right. I guess my other question was, now as the control community, what about Homewood?
Yeah, so Homewood still, if we go back to this slide here, so this is the overall cohort. So Fresh, you did see some improvements in food insecurity. And then if we go to Homewood, you still see that, so Homewood itself has had some investments more recently. And I think someone
Okay.
mentioned, there's, stuff that's recently popped up or, up and coming, or, East Liberty has had like a bunch of developments, right? And that's
Oh,
nearby.
that's true. Mhm.
So yeah, so the good news is that overall, it's still improved.
Okay.
And the
Yeah,
original Fresh study, we had focused so much on the Hill because of the supermarket, but at this
right.
point, both are getting different types of investments. So,
Mhm.
the trends so far are showing improvements, and I think
Mhm.
we hope to see that continue. Yeah.
So you'll continue studying both communities.
Yeah. Right now, we're still looking at both. Yeah.
Yeah, great. Thank you.
Yep.
Comment?
But that's such an
It seems
important
to me
question.
that-
Yeah. Go ahead.
It seems to me that with median incomes that low,
Yeah.
it seems apparent that a for-profit private enterprise food distribution model is never going to adequately address food insecurity in that neighborhood. Would you agree with that?
Yeah. Well, I mean, I think we did see improvements, so that's good. And I think we can see that, the Shop and Save started and then closed, and then Salem's tried, but as someone on the call mentioned, the prices were too high. So I think that, you know, I think if you're just looking for profit and you're going to these communities, I think you're less likely to be successful. We'll see how Macedonia Church does. Hopefully it's much better. But I think, yeah, I think if you approach things with the goal of community improvement and engagement rather than for profit, you're probably going to see much better improvements.
Thank you.
Because the capital is maybe limited in these communities right at this moment, but at the same time, if they were invested in, I think they could reach their full potential.
Yeah.
Well, wouldn't SNAP make up some of that difference?
SNAP,
SNAP.
sorry.
The
Yeah,
income's
so
low, but presumably they are getting that assistance in some way.
yeah, so a lot of this, I don't have the numbers right on these slides, but a good chunk of the fresh participants that are food insecure are using SNAP. Even so, those benefits are, they're helpful for some families. They tend to pull them out of food insecurity. For people who are, having a really hard time, they help, but, they might not be sufficient. So, yeah, so I think SNAP is important. I think higher SNAP benefits could help even more. But yeah, I don't think, especially in a population like this, where the median income was so low to start, that it would be sufficient on its own. Like, I think, so that number is just the median income. All these rates and stuff for food insecurity, food access, um, that like SNAP has already existed. So that's already like, even with that lift or boost from SNAP, you're still seeing these high rates of food insecurity and lack of food access.
Yeah. So the median income does or does not include the SNAP benefits?
No, I don't know. It shouldn't, because that's just income.
That's just
So
income.
we don't, we don't typically, so
Right.
income is like what you're earning,
Yeah,
and the
okay.
SNAP benefit would be separate. Yeah.
Right.
And they're like, it's not even going to affect it that much.
Right.
Yeah.
All right, our next service is going to start church service, so thank you so much. We really
Yeah.
appreciate your time, and we appreciate the fact that you did it on Zoom for us. This was wonderful. Thank you. Thank you.
Thanks so much for having me.
Yeah,
All right.
it's really great.
My email is apf31@pitt.edu, and you can also just search my name online if you have any follow-up questions. But yeah. All right, I'll head out then. Thank you so much. Have a great day.
Thanks.
All right.
Thank you.
Thanks. Bye.
Bye-bye.
I think the average, have we read lately, the average SNAP benefit is $200 a month?